It's very important for children to be able to find out, and families to help them understand what is going on for them. So if they're having some mental health struggles, the earlier there is an intervention, they won't have additional problems, things like low self-esteem and depression and anxiety that can just exacerbate some of the symptoms. I think it's important for parents especially, and teachers sometimes, to know that there is help available. And so some of the first steps that they need to do is a bit of research, I would suggest, because there is a lot of information out there, and sometimes it's good to check some really reliable websites to see what is available, and also to look at the presenting problems and then see where they can go for help. There are many areas that they can pursue, and a really good assessment is especially important so that they get some good interventions and strategies to use with that child. There's a variety of avenues that they can go, but once they've had a good assessment, which they can pursue, either with their family doctor initially, they might be able to help them find that person that would be the one suitable to do a good assessment. It's important to find somebody who knows childhood development and knows what is normal and what is maybe becoming more of a struggle for the child. So they can start with their family doctor, they can go to a counselor, maybe find a psychologist to do the assessment, and those can be found through children's mental health centers, through the websites that are going to be shown, and also calling a hospital or places like that might be able to help them get that connection. It does sound expensive. In a lot of cases, it does not need to cost a lot of money. For example, if you go to your family doctor or pediatrician initially, then that can be covered by OHIP. If you go through a children's mental health center, that also is something. There is a wait list, but they can also get help there without having to have an initial cost. So there are ways for families to get help without having to cost a lot of money. I think it is really important for family members, friends, teachers to be supportive and encouraging the family to go for help and understand that mental health difficulties with children are treatable. And there is help out there, and helping them to feel supported to pursue those things and get the help that they need. And as I said before, it requires persistence, but we know that 1 in 5 children do have some mental health struggles. And so we want to make it possible for families to easily get the kind of treatment that they need for their children.